this next phase, I am going to also invest in myself to become the kind of doctor that I want to be. And so even though it can feel difficult from a time management perspective to add on another thing, or even financially to add on another bill, when you look at all the years and time you've spent on this career, it's worth it. I can tell you absolutely spending the time on yourself, and really that self-discovery is so meaningful.
Greetings, everyone. Welcome to Roots of Healing, the podcast where we uncover the stories, insights, and visionary ideas shaping the future of lifestyle and integrative medicine. I'm your host, Dr. Siri Chand Khalsa, physician and advocate for holistic healing and embodied living. Before we begin, please note that this podcast is for educational and informational purposes only. The views expressed by our guests are their own and don't constitute a medical advice. Please work with your healthcare team for your personal medical concerns. Every week, I have the wonderful privilege of sitting down with trailblazers and thought leaders who are reimagining what it means to be healthy, mind, body, and spirit. Together, we're exploring their journeys, innovative approaches, and deeper roots of healing that inspire us all. This week, I have Dr. Amanda Scott with us. She grew up in the foothills of Pasadena, received her degree in physical anthropology from the University of California, Santa Barbara, and then attended medical school at the Royal College of Surgeons in Ireland. She returned to California for internal medicine residency and has been a primary care doctor for over a decade. She was the medical director at the Santa Ynez Tribal Health Clinic on the Chumash Reservation before accepting a position with UCLA. At UCLA Health, she was a clinical instructor working with nurse practitioner students, in addition to her full-time work as a PCP, before becoming a lead physician and assistant clinical professor. In 2024, she became board certified in lifestyle medicine and left UCLA to open her own practice called Santa Barbara Lifestyle Medicine. She now focuses on providing personalized whole-person care, preventing disease through a natural root cause approach. Dr. Scott, I am so delighted. For those of you listening, we live close to each other, so this was a natural invitation for us to connect and explore more. Welcome to the podcast.
Thank you so much for having me. This is so fun already.
I know, right? Sometimes when I read the intros, I get so excited. I'm like, this person's so awesome.
Thanks.
Anyway, tell us a little bit about your journey. So I have not actually heard of a degree called physical anthropology. Why don't you start there? What kind of degree is that?
So I had never heard of physical anthropology either. And when I started at UCSB, I was undeclared, and that pretty much sums it up. I wasn't sure what direction I was going to go. I just wanted to get there and start exploring. And I started taking classes, and one of the classes I signed up for was anthropology. And, to sum it up, it's the study of the history of humans and how we developed and why we developed the way that we did. I focused on physical anthropology, which explains physically how and why we developed the way we are currently today. But one of the other things I really enjoyed and wasn't an option for a major was biosocial anthropology, at least at UCSB. And that really focuses on why we feel and act the way we do as humans, which is just fascinating to me. So there's also cultural anthropology, which is fascinating as well, but I focused in on physical anthropology, and that was tied somewhat to my desire to become a physician and go through a science or from a science background and being pre-med as well.
And so when you were in the pre-med time, was there certain ideas that began evolving based on your anthropology studies about health and healing that were maybe a little different than some of your colleagues who were biology or biochemistry majors? I'm just curious, when did that?
I think what I was aware of more at that time was the difference in the students in the classes. So I would go from a physics class, a class that was primarily students who were science-based and pre-med, and I would observe the way that those students, including myself, carried ourselves. And then I would go to an anthropology class, where people weren't wearing shoes and maybe still were in a bathing suit, maybe had brushed their hair. And for me, that provided more of a balance to have both kinds of classes. I think that where I ended up is somewhere in between, which is maybe why I felt more comfortable having my degree actually be physical anthropology and not biology, or one of the more traditional degrees for pre-med students. It felt more balanced to me, and I just really enjoyed it. I feel like the education was also balancing what I was learning in the sciences. So I don't think I was aware so much of how that would impact my work in the future, but it's interesting retrospectively to look back at my young self and realize I was kind of already maybe searching for more of a balanced approach.
Yeah, and I think that I was a women's studies. I didn't quite get enough credits for the minor, so I don't want to position myself in a way that's inauthentic, but close. So I did a lot of humanities and anthropology-oriented classes as part of that track. And it does reframe things into a broader and bigger bowl. And also, I grew up near the Smithsonian institutions in Washington, D.C. So it's a huge museum complex in downtown Washington. And I always was so fascinated by the evolution of humanity. I forget which one it's called, but there's one that's sort of like the Natural Science Museum, where you could just look at cultural movement, and they would have cultural fests around 4th of July, and you would go and experience people it's a very international city, so you would experience people's journeys from all over. But I'm curious, so then you had your degree. Did you take any time between undergrad and med school, or did you apply sort of thinking, I kind of just want this different journey? I want to look at how health and healing is done in another country, because it's not that often maybe you hear about people who come from another country and immigrate, but it's not so often you hear about people that make a really conscious elective decision to jump into another country's medical training.
Yeah, it's interesting because even though my degree wasn't biology, if I had stayed another, I think, quarter, I could have been a biology degree. So I basically double majored in 4 years at UCSB, and I was pretty burnt out and just couldn't imagine myself going directly into med school, and sort of recognized I needed to reevaluate my goals and take a break. So I took 3 years between graduating from UCSB and going to Ireland. And my goal during that period was really to take different jobs, do different things. I was a speech pathology aide. I worked in an emergency room. I worked at a primary care office. I really wanted to just get different experiences. And it was through that work and that time that I met people who had ultimately achieved one of my goals, which was to become a doctor, but in maybe different ways. And so that's how I even found out about med school in Ireland as an option for me. And yeah, and I had wanted to study internationally in college, and it just didn't work out. My sister did. She is an architect, and she studied architecture in Florence, Italy. And that was, I went there in 1998 to visit her. And it was the first time I had ever been out of the country. And being in Italy, and we went to London. I mean, it was eye-opening. And that was another goal of mine, was to live abroad and have some different experiences. And so a doctor who really has been a mentor for me, she was working in the emergency room as a resident, and I was volunteering there, and we started chatting, and she really took me under her wing, and she said, well, I went to med school in Ireland. And I was like, what?
Wait, what?
Wait, what?
Impossible.
And I said, how did you do that? I just started asking her all the questions, and it turned out the application, I think it was within weeks of that conversation that it was due. So I went ahead and did it. I got an interview and I got in. And then I went and visited Dublin and said, yes, please, this is amazing. It was a pretty easy decision. And once again, I think for me personally, it felt just 100% right doing it that way. So that's how I ended up in Dublin for 5 years.
Oh, it's a 5-year program there, huh? Or just the way
Yeah.
it comes
The
together.
way that they have a couple different program options now for American graduates, people who already have a degree. But traditionally in Ireland and the UK, the students are coming from high school. And so they have longer programs.
Right. That's right. It's like that through most of the world, actually. They
Yeah.
right out of high school they're much younger when they start their clinical careers. Tell me
Exactly.
a little bit about how that, probably hard to know for sure, but how do you think the training there informed a little bit of how you see medicine and the practice of medicine, or what was some really interesting differences you noticed once you came back for your residency?
Yeah, I think, the Irish culture is so much about storytelling and a lot of the focus, because the students are starting much younger, and they have kind of this longer training tract. It's, the initial years are really spent more learning how to take a history and talk to patients. And so sometimes the assignment was just go into the wards and start talking to patients. And this is obviously the format for how you want to present the information. But this is your assignment, is to really just go talk to people and start listening to their stories. And if you listen long enough, the patient virtually will tell you the diagnosis and the answer. So the focus really was on listening to the patients, which then I came back to America. And we try to listen to patients, but I think there's a lot of other input in regards to data and testing, and the pace is just so much different than in other countries here. And the expected pace of the testing, the orders, the results. And so that's something I noticed was a big difference, is the pace when I came back, and also the testing. We were doing so much at the bedside. And in other countries where the health systems are different, you don't really have the same access to testing like you do here. And so you had to do so much more at the bedside based on the history. And so it was very different. And then to come back and have it be so fast paced, and the testing was just such a huge part of the process. And I do think because of the training tract in Ireland, when I came back, I noticed other American medical school graduates had already been functioning within the hospital healthcare system in a different level, involved in making decisions about patient care, where in Ireland, it was more, we were in a position of observing the decisions being made and trying to understand why they were being made. And so that was also a big change, I was a resident instead of a student. So I was automatically going to be making more decisions, but I wasn't as comfortable making the decisions initially as the American graduates. And I also think just culturally, that confidence in your decisions is different here versus being a student in Ireland. There was kind of that sort of joking mockery, unfortunately, in the system. But at the same time, there was understanding you don't have as much experience as other doctors. So why don't you watch how we're processing this? And then, in the future, you'll do it. But in America, there was a lot more just initial upfront confidence from the students.
I can imagine. Does it cost the same as going to med school in the US? Is there there's the obvious cost of commuting and back and forth. And I imagine some summers were spent in Europe. I don't know, probably family came to visit versus coming back here. But generally speaking, the education, is it priced on par with US med schools?
I'd have to get updated information for now. I was there between 2005 and 2010. So at that time, it was Ireland was having an economic boom. And it was probably the most expensive time I could have ever studied there. And so I was getting my loans from America and the government in dollars, and then having them changed to euros, and losing a lot of money in that in that transition at that time. So I don't know what it's like now, but it was quite expensive when I went. And it was partially because of the exchange rates of the euros compared to the dollar at the
It's
time.
such an unexpected dilemma once you're committed and going. It's like, wait, year 3, you're like, hold on a second. It's $2 for €1. What the heck? I remember
Yeah, and
that.
sometimes based on the exchange rate, that moment of that day would mean you'd lose thousands and thousands and thousands of
Right.
dollars
These
more
are big
than the day before.
dollar
Yeah.
amounts. Yeah. Do you have doctors in your family? Are you the first one?
Well, I'm the first one in sort of the recent generations. I have great grandparents and great great grandparents who are physicians, but no, not, my parents are not physicians. My family members were mainly in the medical realm. They were generally nurses. So my grandparents on my dad's side were both nurses, and my aunt is as well. But nobody in sort of the recent generations that I interacted with were physicians or are physicians.
So you were really sort of embarking on a really unique journey without necessarily a parent saying, do this or don't do that. Grandparents are usually a little bit removed in a lot of circumstances. So what actually brought you back? You ended up doing your residency at UCLA. And is that right? Yeah. Did I get that right?
No, I did my residency here at Cottage Hospital in Santa Barbara.
That's right. And so thus began the love affair with the Central Coast, right?
Well, my love affair with the Central Coast started when I went to UCSB originally.
Yeah.
And when I left, I was just heartbroken. I had fallen in love with this area. And although Pasadena is beautiful, I knew I wanted to, ultimately my dream, if I was able to, would be to return and live here. And so when I left UCSB, I was just so sad. And I thought, okay, I'm coming back, at some point in my life. And so when I was in Ireland, they do have the summers off for med school. And so most of the American and Canadian students going to school in Ireland spend their summers doing rotations at hospitals and at medical facilities that they're interested in doing residency at.
That makes sense.
And so that's what I did. I did as many rotations as I could possibly do in Santa Barbara. I just kept popping up. And I worked at a didn't work. I did rotations and shadowing at a cardiology office with the residents as a pre-med student. So they did get to know me pretty well. And I don't think you can do this actually anymore, but I did what's called pre-matching. So, I was a known entity. I had liked working with them. They liked working with me. And so I didn't have to enter the match. And I just went into an agreement with Santa Barbara Cottage Hospital Medical Education at that time so that I knew exactly where I'd be going. And obviously I was thrilled about that because Santa Barbara was where I wanted to end up.
That's a fun, amazing story. And it just shows the value of setting an intention and having a focus and figuring out what might seem impossible that can be just a series of steps. And I think your career speaks so wisely to that you can maybe have what you want. And it's not all delayed gratification like many doctors sort of surmise it is, embittered doctor persona. But I'm curious, were you single through this whole process, or have you find a partner along the way?
So that's another funny story. I was back in Santa Barbara visiting a friend the summer after my first year of med school in Ireland. So even on my breaks, I'm headed up the coast. Bye, Mom and Dad, I'm going to Santa Barbara. And was hanging out with a friend from college up here. And that's how I met my now husband, Jeremy. He was at the same party and he's from this area. And so we met. And then we started dating internationally that summer. So he ended up coming to Ireland to visit me. And then he ended up applying to med school in Ireland as well.
What?
When he saw what I was doing and he said, well, this is an option, Yeah, and so he went to the University College Cork, which is hours south of Dublin, but at least we were in the same time zone.
Yeah.
And so he was a couple years behind me in med school and in Ireland as well. And then we ended up getting married in 2010 when I finished med school and was coming back here for residency. So then we had an international 2-year marriage of him being in Ireland while I was doing residency And him being from Santa Barbara, he wanted to end up here as well. So then he did residency at Cottage Hospital also.
Were you the chief resident by the time he put in a good word with I'm sure his merit, of course, stood on its own.
Yeah, they were really, really excited to have him as a resident as well.
I'm curious, one of the things we had shared a little bit before we started talking is one of the ways to be able to really pivot and innovate in your career is to sort of divest yourself one way or another of your student loans, whether you're earning, working triple time to pay them off, or you take certain other pathways where there's loan repayment. And you mentioned that you really thought about that. And I'd like to hear how you went about thinking about it. And then where did that take you in terms of work?
Right. So that's such an important part of my story as well, because as I mentioned, I went to medical school at an extremely expensive time in Ireland. And, you kind of push that to the back of your mind as a med student, thinking I'll deal with this later, and then you're so invested as the years go by and you want to graduate, you want to become a doctor. So there's sort of this sense of no turning back as the loans are mounting. It's a really, really significant, thing in medicine to carry that debt. And then when you graduate and you become a resident physician, then you start getting calls, really scary phone calls about your debt and the reality of paying the money back. When I learned about the ability to pay my loans back through the loan repayment program through the government, I obviously, looked into that as an option. And the requirements fit in regards to what I was looking for. You have to work for certain types of organizations, whether they're in a nonprofit, a tribal clinic, an education, like UCLA. One of the reasons I went with UCLA was it fulfilled that criteria. So I was happy to sort of stay within that criteria. But there were some other really difficult realities about it that you don't also think about when you're a resident, that you have to continue to work full time to be within the parameters of getting your loans repaid. And so, when you start having children, you don't have the ability to work part-time. Those kinds of aspects of the loan repayment program were very, very difficult. But the wonderful part of the story is that I did, continue forward with the loan repayment, and I did have my loans forgiven, which was, a huge moment in my life to feel like that weight had been lifted off of my shoulders after carrying it for, 13 years. And so
and feel we have that in our household. Both of us have significant medical educational debt. And though you look at those student loan payments and you're just like, whew, okay. And especially for me, because I had stepped out of clinical from all of the COVID complications. So those loan payments are still sitting there waiting for you, and even if you do deferments or renegotiate them. So I think finding these, was yours the PSLF or was it a separate program?
Yeah, it was a public service loan forgiveness. I think that's what it's called. Yeah, so it was quite a journey. And yeah, it's something that even when you're not actively thinking about it, and you can sort of take almost these breaks where life is just crazy and you're not thinking too much about it. Sometimes I would see the numbers, and it was almost just like breathtaking to think that I actually did owe that amount of money and that it was my responsibility, to figure it out. And so for me, that's how I ended up doing it. And I do believe that the experiences I had because of needing to fulfill the requirements for that loan forgiveness did contribute hugely to the physician, that I am. So I'm really grateful, even though it was extremely difficult over the years. It was part of why I have the experience that I have. And so I am really thankful that A, I had the opportunity to have my loans forgiven in that way. And B, that the experiences I have all sort of come together in regards to where I find myself right now.
Which is, again, really intentional living. And I think that people who might be listening, younger clinicians, it may be that the status of PSLF is changing with the administrative changes, but it's still worth knowing about if you're not familiar. And there'll probably be similar, perhaps, incentivization for people to work in more rural environments. Tell us a little bit about your experience working with the Chumash. I have to say that when I first came to Santa Barbara, I had never really spent much time here. But as the 2 years that I've lived here and we've traveled around, there have been so many moments where I've thought, what an incredibly blessed land this is. And for the people who are indigenous to it, the Chumash, it must have been an incredible life prior to colonization. And I don't even know, actually, in hindsight, all of the various different groups of people that came in and commanded the land or disrupted the life that was so sort of gently and blissfully in its own way existing here. And we think about some of this, and I'm not an expert, but I imagine there is some degree of resilience and also trauma intermingled into these groups. Was that something that was very consciously woven into the clinical care models? And because I feel like that's something we're more understanding, this generational trauma, the impact to health, the impact to resilience, the ability to have access to healthy food, movement. These things can be limited through poverty. And being in Arizona, I knew quite a bit about it, but I don't know as much about how the Chumash community is able in the current times to function. I'm curious, imagine being there for some time. You gave these things a fair degree of thought.
Yeah, I think for me coming into it, one of the main things I noticed was the fact that I really needed to earn the trust of my patients, that there was this foundation of distrust and trauma, which I totally not understood personally, but could understand from their perspective, that I was coming in as this young physician. And I definitely needed to spend time with the patients and getting to know them so that they could have that trust in me in their care, that it wasn't just taken for granted that I could walk in and make decisions or make recommendations and have them trust me. So it definitely took time. And the hard part about that for me and the patients was I was there for almost 7 years. And so I did gain a lot of trust from my patients and from the community and the tribal elders. And it was really hard. A lot of patients were so supportive and understanding, but there was also this sense of you're leaving us. And so that was a hard part in regards to needing to put in the time to gain the trust. But it was warranted, and I could see where that was coming from, obviously. And then I think also, there was an acceptance of other types of care outside of traditional medical care that were valid and important. We had another physician there who was practicing integrative medicine. It was very supported by the clinic and by the patients, and it was very positively accepted. And you could see that in contrast in other institutions, that it wouldn't have been as accepted as it was, I think, if we hadn't have been in a tribal clinic. And the same, recognition of looking at the land around us, around the clinic, that doctor would take us out to look at the plants. And so I think that there were just some things that weren't happening maybe at other clinics, but at the same time, it was the only clinic I had ever worked at that time. So it was a really great experience. And I think it was humbling. And I think that that's good. I think that it's good to take a step back and just learn from those around you and listen. And we also were given that time as clinicians to spend time with our patients. So there wasn't as much pressure in regards to productivity that I've seen in other places. The focus was more on, are we providing high quality care? Are the patients happy with their care? All of the patients generally were from right there in the community on the reservation. And so we definitely were wanting to make sure that we were taking care of the patients in a valuable and meaningful way to the patients themselves. So it was very close-knit. You got to know patients and their families and the different connections between the families in such a unique way. And so I definitely learned a lot there, and I'm so grateful for that experience.
It sounds like it was really life affirming and also helped just build an understanding and awareness of the Indigenous perspectives on the region and the particular struggles that they may have and triumphs. It's not all painted as just tragedy, I'm sure. There were very unique and special elements to that. And then from there, you kind of went into a more traditional practice, and we all kind of know how those go. So, um, no dig to wherever it was you might have worked. We won't go into a ton of detail, but it feels like there came a sort of intersection moment for you. And I believe you've even done some writing about that and shared that. And I'm curious, sort of in that process, was there something inside you that said, there's got to be a better way? Or was it more, I'm just not feeling aligned to what I'm doing? Or was it a little of both?
I think it's a little of both. I think the interesting thing about medicine, and anybody who's gone through the different stages of their medical career can probably understand that, you're always sort of, at least I was feeling like this next phase will be different. This next phase will potentially be better in regards to my work-life balance or my sense of alignment with the profession. And also being in such a long training model, you're in so deep that there really doesn't feel like there's the ability to pivot so much once you're in it. And I think, I was working, as I said, within the constraints of the loan forgiveness but picking jobs that felt right. But then also realizing through each phase that it still wasn't quite the right fit for me, and starting to wonder, okay, I'm working on a reservation. And then sort of the other extreme, I'm working for UCLA and working at a really fast pace, and just sort of the extremes of different models, and realizing, okay, I don't know if there is actually a clinical realm within traditional medical practices that is truly in alignment with me. So I think that it was just over the years sort of coming to the realization that something that was going to work for me, I hadn't seen, which is also really scary.
Uh-oh.
Exactly. And so I think, and I've done a lot of work in that area, working with a physician career coach, Dr. Karen Barnard. She was amazing because it was all about coming back to myself as a human being, because you really do get kind of lost, at least I did, in the system within medicine. I felt really lost. And, you throw in motherhood and all the responsibilities from those two realms, my profession and being a mom. And it was really, I needed to come back to who am I, what brings me joy, and how can I weave that into a practice that I love? And so that really became the question.
How did you learn about lifestyle medicine? Had you kind of just seen a conference flyer? Did you have a friend? Where did it
So
first horizon?
Yeah, I had never heard about it until I worked with Karen Barnard, because part of my work with her was sort of these assignments of, worksheets and sort of understanding what I enjoyed about medicine and what I enjoyed in my own life. And it was through doing research that I found it. And I remember opening up the American College of Lifestyle Medicine website, and I'm not quite sure how I found it. I think I was just looking at like alternative types of medical models, and it came up. And I remember reading through like just the first page on their website, and it was like I had come home. I was like, oh, here it does exist. I don't have to create it because it's here already. And I can just sort of make this transition to focus in this area.
And what was there, as we know, there are 6 pillars in lifestyle medicine. And I feel like most lifestyle medicine physicians, there's meaningful connection, removing harmful substances, restorative sleep, actual movement, whatever the number boils down to, at least 150, I think, minutes per week, a plant forward diet. And I'm wondering if there is, and stress reduction, I'm wondering if there's an area that initially really spoke to you and you said, or was it really just all of it?
I think that's what I loved about it was all of the things that I was talking to patients about, or at least trying to, that was meaningful to the patients. And just the patients I was working with in those 6 areas, it was the most meaning. And I had patients tell me, this is the best and most meaningful visit I've ever had with a doctor, when we were talking about those 6 areas and not, the particulars of their lab results. And the lab results obviously are important, but you're working with people, and in primary care, at least, the patients are coming to you with things like, I don't feel good. I'm in pain. I'm suffering, and I really don't know why. And those are such complex discussions. And in reality, it comes back to a lot of the things you cover in those 6 pillars. And so the deeper discussions were where I was finding myself most helpful and having the most meaning in my own from my professional perspective, but also clearly the patients were gaining so much from those conversations. And I think also just feeling heard, that I wanted to have conversations about their suffering in a more meaningful way so I could understand it and try to listen and help. And so I think that's why I liked it so much, is it wasn't one particular area, that humans are so complex, but that those 6 areas could at least give me some structure to have conversations about their life on a deeper level.
Yeah, it's such an important topic. And you've shared with the listeners a link to a Mayo Clinic Proceedings article on the foundations of lifestyle medicine, where Dr. Lipman is the lead author. And I just wanted to read a little passage from that because I really appreciate this paper. It says, the American College of Lifestyle Medicine, ACLM, defines lifestyle medicine as a medical specialty that uses therapeutic lifestyle interventions as a primary modality to treat chronic conditions, including but not limited to cardiovascular disease, type 2 diabetes, and obesity. Lifestyle medicine certified clinicians are trained to apply evidence-based, whole person, prescriptive lifestyle change to treat, and when used intensively, reverse such conditions. Applying the 6 pillars also provides effective prevention. It seems like what did we miss in our medical model, where these things are not just the foundational parts of medicine? And ostensibly, many lifestyle medicine doctors would argue that this should be the foundations of how medical primary care is offered. Did you ultimately decide to tell us what your model is, because I think this is also a very important part of the evolution of this field, and how you're doing it now may not be how you're doing it 5 years from now, but love to hear where you landed as you said, well, I'm going to transition from this more structured environment where all the pieces are already decided for me into something that has sort of a much bigger sense of uncertainty, but also imagination. So tell us a little bit about the pivot and where you've landed in your practice.
So for me, I think the main first step was to leave primary care in the traditional sense. By the time I left, I was so incredibly burnt out, and I think I felt, my feelings within the field of medicine are really complex, and I think I needed to leave for at least a time period and reassess and really sort of lay out a foundation of the way that I like to practice lifestyle medicine and then go from there. So it's definitely ever evolving. And I was kind of like laughing when you said something like in 5 years it'll be different. And I can tell you already, it's changing already. And that's part of the fun. My first step was leaving primary care in the traditional sense and really creating my own practice. I had spent the entirety of my career following instructions sort of by the institution. I could have some realm for creativity in the work I was doing in the room with the patient. But other than that, my time and my days were 100% dictated by a structure that I had no control over. And so I think I needed to leave and then decide what that structure looks like per me and what is meaningful to me. And that's really the phase I'm still in. I left UCLA last summer, so it's only been 7 months. And I have started my own practice. I'm seeing patients. I'm board certified now in lifestyle medicine and really learning a lot in regards to how to practice lifestyle medicine. And it's been really fun. I think one of the main things I love about medicine is learning. I think that's one of the main reasons I got into it in the first place is I really enjoy learning. And so that's been a fun part of the process is to learn this other specialty. And I do wish I had been introduced to this information so much earlier because it would have been really helpful as a primary care doctor for sure.
For sure. Are you a consultative model or are you doing primary care? Is it kind of melding into one as we speak?
Yeah, so I'm doing right now, the way that my practice is structured is I have a free meet and greet. And really, it's an opportunity to talk to patients more about what lifestyle medicine is because nobody really knows unless you're in it. And so it's an opportunity to find out what the patient's looking for, let them know what lifestyle medicine is all about, and describe how my practice works. And then if they want to move forward after the meet and greet, I do an hour and a half lifestyle medicine consultation, which includes a review of their medical history and sort of the more traditional initial visit with the doctor. And we do an assessment of the American College of Lifestyle Medicine. It's called the long form, and it's really a questionnaire that they fill out ahead of time to cover the 6 pillars and a bit more. And we use that, or I use that during the consultation as a basis to review things really comprehensively from a lifestyle medicine perspective. But the interesting thing I've found, and the part that I love, is sometimes we'll literally just start on page 1 of the assessment form and we never leave page 1 because there's so much to unpack. And, I've found with a couple patients, we start talking about a topic that really is the main barrier for them for everything else. And they agree, I've got to sort of address this one area before I can even consider the implementation of these other healthy lifestyle measures. And so it's really fascinating. It's different for every single patient, but I do an hour and a half consultation. And then I have a couple different membership models based on how intense the patient wants to approach their changes. And so then we go from the consultation to usually one of those models, and then we go from there. And so it's really fun, and it gives me a lot of flexibility and the patient flexibility as well.
I'm sure you're going to get a flowing, happy series of feedback because the ability to really sit with someone who is very knowledgeable, but also going much deeper into sources of problems. And I think a lot of lifestyle medicine clinicians that I know ultimately bring their toolbox a bit bigger than the 6 pillars in a practical way. They may look more intensively at trauma histories and make very appropriate referrals for care. They may look at financial health. They may look at environmental health. There may be other sort of tributaries that come from this larger body of philosophy. I know we have people that are listening that are thinking, how do I do that? By no means are we offering legal advice, but ultimately you formed a PLLC, I imagine, and you're carrying standard medical malpractice. Is that right? So you're not existing as a coach. You're still really, this is the conversation a lot of people have within themselves of, can I actually be a coach if I'm a physician? And we're not going to be able to answer that on this podcast, but it ends up being a lot of coaching, but also there is inherently a review of systems of looking at medical diagnosis. I don't think we can easily fully divest ourselves of our degrees. And to the extent that someone looking in might say, I think this is medicine, not coaching. And so I'll just put that out there for people that are really giving this due diligence, that there are smaller malpractice policies for these smaller practices that make the whole process a little more affordable. And I also know that sometimes the physicians and family members around us, because I kind of think of myself in this lane, although it's a little bit abstract, are often uncertain about what we do in our days anymore. And it can be a little confusing having an elevator speech to explain to people, this is what I am doing. And I'm curious if you found that to be the case for you as well, where you run into people, and I want to just normalize that for others if this is something you're experiencing too.
Yeah, I think that's been a little bit more, I don't know why, but unexpected area for me in this transition is Santa Barbara is a small community, and, most of the doctors know each other, and I have a great relationship with the medical community here. And it's been interesting because even despite that, despite all the experience I have, all of the positive interactions with all the other doctors in town, it's still that realm of the unknown. And I think that there's a lot of not fear, but just lack of maybe understanding, kind of like, well, I don't really know what you do. And it's interesting because the patients really get it. Like when I would tell patients what I'm doing, they're like, well, of course, that makes a lot of sense. But I think it's hard to see how this type of medicine fits into cohesively. It's hard to see from the sort of traditional medical perspective. And so that's been a little bit difficult, just because I think also as a physician, you go through your career, generally being respected and have people really have a positive response, when you tell them you're a physician and what you're doing. And so it's been an interesting personal experience for me to be at peace with the fact that other medical professionals or otherwise have a very blank and confused look on their face when I tell them what I'm doing now. Whereas in the past, is always consistently very positive. So I think that's been hard, but I'm working through it, and I understand that that's also part of the work I'm doing, is representing this area of medicine and bringing it just back into the conversation again and again and again, so that hopefully someday it's not considered kind of fringe, which it's so crazy to me that the way you lead your life is fringe, but that's the way that it's kind of treated in the conversations with a lot, and I'd say most other physicians.
I think you're right. I'm 7 years into a sort of atypical physician career journey, and there's been a lot of unlearning along the way, a lot of self-value, self-worth outside of the approval of the larger purview. And I think really when people hear about it, they think this is a doctor maybe overqualified to do this. And I think that I sit in a certain sort of belief around that of not really, because really being able to understand the depth and changes that have taken place in someone's body that take them into a state of imbalance or disease gives us such a unique lens in terms of how we come into those conversations with guidance, empathy, compassion, support, wisdom, knowledge. All of that is mixed into versus someone with a lot less clinical experience. And not to say there's not value happening from coaching or lifestyle support, but I think a lifestyle physician is a gem. And I hope that really the larger communities can start to see. And I taught a lot of the nutrition curriculum in the Integrative Medicine Fellowship in Arizona for better part of a decade and a half. And it's so abhorrent that, my nutritional background outside of my abject love of food and nutrition in medical school was really biochemistry pathways, right? It wasn't anything more sophisticated than that. And when you talk to doctors about nutrition, which is just one of the main pillars, they all move the lever. They often say, well, a nutritionist can take care of it, or an RD, or maybe they find an app they like, or a book, or they follow someone on social media. And I say, there's nothing quite like being with someone through habit change and understanding that even if you don't understand the nuances of nutrition, to empower someone to know the value that the food choices they make directly impact their preventive process and their potential recovery. And I think that it's just a funny thing. It's almost as though it's like in this terrain of like, it seems like someone with less experience could easily do this work, but then I always come back to, but no one's doing it. So,
Right.
the nutritionists and RDs are very busy, very difficult to get in to see them. And I'm sure we may have someone listening who's like, I'm here, I'm available. And I'm not saying there's not value. Of course, there's immense value there, but there are so many places where people need support, where they've been really just consuming things online or peripherally, or their cultural background is such that the habits in the kitchen, the habits around sleep, the habits around movement, the habits around connection, the habits around harmful substances are all, and they're isolated. All of that is in this big soup pot. And I think it's also one of the largest and most vibrant growing specialties. And I think a lot of that comes from, which you've also spoken to, this inherent revitalization that happens for clinicians when they themselves apply these principles, which has always been one of my favorite metrics of all, which is maybe you're not fully seeing the value because it's not something that you yourself are able to do. So it's going to be a little easier to keep it at a distance than to really bring that camera towards self. And so I think it's so incredible, the courage that you're bringing into this. And we're starting to wrap up our time. It's gone just like that, as it always does. I'd love to hear any kind of closing thoughts or words of wisdom for someone who maybe is at that junction where you were sort of sitting in your primary care office a year and a half ago thinking, what other options do I have? And maybe some words of wisdom for them.
Yeah, I think that self-exploration and getting the space, that safe space to really delve into the experience I had in my medical pursuits personally, and then also how was I going to practically move forward with it, and getting, doctors are great students. And so we get assignments and it's like, I will do it. And so for me, that really helped to have the guidance of a coach myself. And as I said to the coach when I started, I've invested a huge amount of money and time to become a doctor. This next phase, I am going to also invest in myself to become the kind of doctor that I want to be. And so even though it can feel difficult from a time management perspective to add on another thing, or even financially to add on another bill, when you look at all the years and time you've spent on this career, it's worth it. I can tell you absolutely, spending the time on yourself, and really that self-discovery is so meaningful. So if there's any first step, I would say it's to get a coach and a therapist.
Agreed.
Yeah, for
Essential.
sure.
And of course,
Yeah.
I always tell clinicians, like, the things you're saying to yourself, would you say them to a friend? Probably not. And so we deserve the same peacefulness, contentment, happiness, joy that we would wish to any of our patients. And I think the lifestyle community tends to have people that are pretty mission-based, empathic, who are those lifelong growth mindset people. Well, it's been such an amazing conversation. It flew by, as I imagined it would. Tell us how people might find you online. And do you have for right now, you could probably only see people in California. Is that right?
That's right. If your permanent address is in California, then I can see you. If you travel or if you're in other places, I can do video visits if you're outside of the state, but your permanent address still has to be in California for my license. But my website is sblifestylemedicine.com, and I'm on Instagram as well, SB Lifestyle Medicine. And so I just have a lot of information on my website about my practice, but mainly about what lifestyle medicine is. And there's some of my story on there as well that I've told today, as well as other written work I've done. And so I put a lot of time into my website, so you can check that out. And you can also contact me at Dr. So that's Dr.Scott at sblifestylemedicine.com.
And we'll put all of that in the show notes. And I will say, if you connect with Dr. Scott on her social media and you enjoy plant-forward nutrition, which you might if you're connected with me, she has lots of beautiful pictures of her garden and her kitchen creations. And I think that being joyful in the kitchen is definitely something I sense from you. And it's fun to watch and see you blossoming and blooming in this new portion of your career. And I want to thank you so much for just taking time and being with the podcast listeners today. Thank you, everyone, for listening in. And thank you, Dr. Scott.
Thank you.
All right, everybody. Well, tune in, and we're excited to continue to showcase these beautiful clinicians. Take care, everyone. Have a wonderful week.